Thank you now for joining us for the session on using community needs assessment data to inform program development. We have two presenters joining us for this session, offering both rural and urban perspectives on this topic. Rilwan Feyisitan Jr. serves as president and CEO of the Community Action Partnership of Providence County. He oversees the agency's programmatic functions, organizational spending, contract management, reporting, fund development, program evaluation, organizational operations, and more. Prior to coming to CAP, he served as the Chief Administrator for the Office of Minority Health at the Rhode Island Department of Health. Rilwan also serves on numerous state and national boards and commissions. Jamie Chandler has worked in health and social services fields for nearly 20 years. Since joining the Aroostook County Action Program in 2013, she has been a key leader in the organizational transformation at ACAP to adopt a comprehensive service delivery model that incorporates a whole family approach to delivering services. Jamie continues to advance this work in her current role as Chief Operating Officer. In addition, she is a national certified Roma implementer, and she earned her Certified Community Action Professional designation in 2021. Thank you, Rilwan and Jamie, for joining us.
We're happy to be here.
Glad to join you all as well.
So thank you everyone for joining us for our presentation today on our community needs assessment and the way that you can use the data that you collect through your assessment to inform your program delivery. Rilwan and I have some unique experiences with this, with community needs assessment, both from a rural and urban perspective, and we're excited to share with you today some of our experience and lessons learned.
We're really excited. We know we are the buffer between you and lunch, so it's always challenging to bring data right before that time. But like Jamie, we're just excited to help demystify as well some of the unique balances between program and the data side. I have a public health background before coming to CAA, and I'm at my core a program person, but learned to have a great respect for our evaluators, our data and evaluation teams. So together, it's a great marriage, and we're happy to share today about our perspectives.
Wonderful. So I'm going to go ahead and share our presentation. And going to go ahead and advance the first slide. Rilwan, would you like to go over the agenda?
Yes, again, we are glad to be with you all at this part of the day. We're going to look at community needs assessment in a general overview. We're going to look at research process and participation, dissemination of report findings, and most importantly, we hope lessons learned both in the process and through the pandemic. All right.
Great. So I'll start just sort of providing an overview of the community needs assessment. So community action agencies are required to complete a community needs assessment at least once every 3 years. I know some states in Region 1 have a requirement of every 2 years. And then, of course, it is always important to assess annually to assure that you are still working on the needs that are present in your communities. But the purposes for this are to determine the underlying causes and conditions of poverty within the communities that we serve, to identify the available resources to address unmet needs. And this requirement is one of the things that sets us as community action agencies apart from other nonprofits. It's our ability to be nimble and pivot as needed.
I don't think we can underscore that. That's what makes us different from other 501c3s. It allows us that ability, again, to meet needs in real time. So this work is critical to what we are as community action agencies.
So this is where you get into the meat, and this is where, for those of us who are very excited about meeting with people and talking with people and gathering data, this is the fun part. For those of us who are evaluators, this is also a fun part because this is where you really get into the details of collecting the information for your community needs assessment. So first and foremost, it's looking at secondary data. So this is data that is likely available through internal resources. So it may be our annual reports that we provide. It could be our program reports, could be information that we collect on customer satisfaction or other surveys. Could it be staff surveys? Also can be information that's widely available from other organizations that do community needs assessments, the census, of course, and HUD, and there are many, there's a plethora of organizations out there that do provide this data that we have access to and should be, and encourage everyone to be using as they are collecting the data for their community needs assessment.
Great. I think, again, we just have a plethora of information. I think the challenge is not to fall into data paralysis because there's so much out there, but to really just do a really deep dive, look at what we have internally with the reports, the work that we do. I know there was a presentation right before I was looking at how some of that was done with one of our sister agencies here in Rhode Island. But again, just doing that deep dive, looking at what those rich data sets have and figuring out ways that we can expand upon that. Again, we do so much amazing work throughout the country, particularly here in Region 1, which we're really proud of. But again, there is great data sources out there, our community food banks, again, census data, and a plethora of other resources that you can look at to supplement the work that we do.
Absolutely. For me, the fun part is the qualitative research. So this is where you really get to drill down and learn about the why behind why the data is the way that it is. So in our experience, we've been able to collect our qualitative research through stakeholder interviews, focus groups, and through community survey. We're going to talk a little bit about our individual processes for rural and urban. But one thing that you'll learn is that our processes have been really similar as far as how we collect this qualitative research. And so it's been for us in Maine, we just recently did a statewide community needs assessment. And so it's been a really great experience to really pull all of this information together and be able to tell a story with emotion. And our report has the quotes from our focus groups and from our stakeholder interviews that really bring that emotion and give people an opportunity to really relate to the data that's in the report.
Jamie, I think, again, across the region, many of us are doing some similar approaches to doing the work, whether it be focus group, our community surveys. I'll share momentarily on a future slide some work that we did, bringing in action research, participatory research, and photo voice as another way to do some of this qualitative research as well. So you can cut and dice it many different ways. And I think that's, again, in demystifying this, there are a lot of ways and options that we can go about it. But the real work is getting out there and really hearing from our stakeholder groups about what their experiences are and how we can better respond and be reactive to what's happening. And if we're really good and on our games, being proactive and being intentional about how we do change at the individual, community, and family level.
Absolutely. And then once you have your data, so we have our qualitative data and our quantitative data, it's really important to be able to take that. And so this is sort of why you're here today. And, you know, what do you do with it once you have that information available? And so essentially, it's really important to go through a prioritization process, because if your needs assessment is anything like our most recent needs assessment, there are a number of needs, so many that it's difficult to count all of the needs that are out there within the community. And so as community action organizations, it's important for us to do some prioritization and really look at, you know, what is our mission? What are the resources available in the community? What is it that we want to be working toward where we can really make an impact and a difference? And so really focusing on how to do that prioritization of your data. And then having said that, we did that at the state level in Maine because we did do a statewide community needs assessment, and then each community action organization involved in Maine did their own prioritization, because every one of our geographic regions has slightly different needs. And so we were able to individually conduct a prioritization process as well. And so as Rilwan and I were preparing this presentation, one of the ideas that Rilwan brought up was, perhaps there's opportunity as we think about community needs assessment more broadly and regionally to possibly coordinate regional needs prioritizations based upon each of our assessments.
I think there's just a plethora of opportunities that are there. I just want to highlight one thing because, again, we look at our large overall state data collection, and we do that in the aggregate and kind of work across our sister agencies across our individual states. But on the individual level, there's many opportunities to also get that drill down, peer down information that you're looking at. In Rhode Island, we've done it several different ways where we've added additional questions to the overall state assessment that we were able to do so that we had apples to apples comparisons across the state, but on an individual CAA level, we were able to add additional questions very specific to our catchment areas that we were working in. This year, because of COVID, we did less of that, but we're looking to do more of that drill down through our focus groups as an example. So some of the questions will be a little bit different, specifically to the areas that we're working with. Being in an urban area, they are different than some of our rural and outlying areas. But collectively, I think COVID's been the great equalizer. So much of it is similar, but there will always be those unique data points that we might want to drill down a little bit more with. And we invite you to do that as well.
Absolutely. Just going to, just checking the chat to make sure that there were no questions in the chat. All right. So just wanted to talk a little bit about the processes that each of our organizations have gone through in collecting data, both looking at rural and regional approaches. And so in Maine, for example, we held over 150 stakeholder interviews. And so our group, we have 10 community action organizations in Maine. And then we have our Maine Community Action Partnerships. And so each of us provided a list of stakeholders that were either regional or state at the state level that we invited to interview with our consulting group that helped us to conduct our assessment. And so these they may have been leaders in quasi-government organizations. They may have been in state offices. They may have been business leaders in the local community, board members in some cases. So we had a number of individuals that we selected to be a part of this, and most of them had some sort of a subject matter expertise that we wanted to have included in our community needs assessment. Secondly, we held a number of focus groups. We had 25 focus groups with over 250 participants. Because we did this last year, we were dealing with a number of pandemic-related challenges. And so some of our focus groups were conducted virtually through a Zoom platform. Some of our focus groups were actually conducted in person. And one lesson learned is that in Maine, July is the nicest month. I'm sure many of you can relate. And some of our focus groups were not as well attended during that time because the weather was just so beautiful here during that time. But we did focus on inviting members of the community action services community to those focus groups. So for example, our agency, we looked at the customers that we served, and we specifically targeted our audience to the individuals that we serve, because we really wanted the opportunity to hear directly from the consumers, what they're seeing and what they're experiencing. And that perspective has been so helpful to us as we've done some data analysis and really looked at what are the needs of the low-income community members within the state and our local communities. And thirdly, we wanted to hear from the overall community. And so we sent out a number of community surveys. We utilized our social media outlets, our websites to promote the community response, the community survey, and we received over 7,100 responses across the state for that community needs assessment. We had a pretty great response. I'll talk about some lessons learned as we go through the last slide, but it was a great opportunity. We had responses from, because one of the questions that we ask in the survey is, what is your level of income? We asked some specific demographic information, which allowed us, as we analyzed our data, to be able to sort out responses by income level, by age, by a number of different demographics to help us to better understand. The other thing that we did with our focus groups, I skipped over this, I apologize, is we did some oversampling of minority populations because Maine is not as diverse as some of the urban areas. We felt it was important to provide opportunity for some specifically targeted focus groups to really better understand what the needs are for our minority populations. And so those were also the data that was gleaned from those focus groups was extremely helpful and highlighted in our specific report.
Thank you for addressing that. That was one of the questions in the chat as well. But I think it's also imperative that we're intentional, not just racial ethnic sampling. Even in states like ours, we have very high concentrations in our core urban centers. But we really were intentional this year in our survey looking at groups that don't potentially utilize our services. So are those unmet groups. So again, we serve in my agency alone 33,000 people in our metro urban area. But there are a lot of folks that come in groups, our blended families, undocumented populations, and many other groups that have difficulty accessing our services. So that hard work of oversampling and really digging down is really important. We informed our community survey, which is done through our state association, through the 7 CAP agencies in Rhode Island. So we've done a lot of the work that Jamie highlighted that's happening in Maine. But we also did some local work that I just want to give you a different feel and flavor for that helped to inform the work that we did on our larger state assessment. We and our local CAP agency had the audacity to do a large needs assessment off cycle and on our own, which has its own challenges and variables that go along with it if you're not hiring an outside consultant. But in the middle of the pandemic, this was 2020, we set out and actually sent out a survey to 7,000 of our own residents, a subset of our 33,000. And that was pretty audacious to do that right before Halloween in October of 2020. If those of you that don't have PTSD know that December was probably the peak and height of all the things happening that were COVID and much of the struggle. But what it allowed us to do is we had over 2,000 respondents to that survey. Staff questioned whether we should be doing it. Everyone thought we were crazy to be doing it in the middle of the pandemic. But what we understand is data translates to action. And that's what we hope that you're doing it. And part of the process was to help convince our staff that it was worth undertaking this and really helping to understand what was happening in our populations during the middle of COVID, when the struggle was at its peak for us. So we were able to do that work. And the majority of those came in between Halloween and Christmas. December was that peak spike when everyone was really going through it. But what it allowed us to do is move a plan of action as we went into 2021. So we were able to have real-time data with 2,000 of the people that we serve. We were able to understand not only what we thought was happening in the community, but specifically allowing them to tell us what services they needed us to do. So truly to be able to pivot and be to react in real time to what was happening. So we had what we felt was our thumb on the pulse of what's happening in the community. A lot of it aligned, but there were also things that did not align. The other thing that informed that is before we did the survey during the summer, we actually did a unique assessment through Photo Voice. If you're familiar with it, it's based on participatory action research. And we actually employed 25 action researchers to go out and do assessments in the community. So they were able to do a bunch of projects based on a action question, research question, which was, how does poverty being impacted by the COVID pandemic that we were in? So they were able to go throughout our communities, BIPOC students of color that were trained to go and do the methodology and the work that was behind it. So we actually had a lot of qualitative data, actual accounts. They went and did over 50+ key informant interviews that also supplemented the hard copy surveys that we did a couple of months later after the summer was over. So that data, again, allowed us to really be in real time seeing what was happening in the community, hearing it from a bunch of different perspectives. And the side note to that is it allowed us to employ BIPOC leaders and students of color, because that was one of the things that came on the assessment was jobs were still really big in addition to PPEs, in addition to all the things that were happening. So we were able to address that school deficit, out of time deficit with real action, real research that informed our work to this point now. So I'll pass it on to you, Jamie.
Okay, great. So, we spend a lot of time doing the data collection, and we have these wonderful reports. And so, what do we do? How do we take in some cases, a 300-page report and turn it into action for our community action agencies? And so that's essentially what we're going to talk a little bit about here is, identifying what those needs are and prioritizing them so that we can develop plans and, implement strategies to address those needs. And then looking forward, identifying a timeline for how we're going to be doing that and prioritizing those needs and the leadership needs of your agencies. So as we are identifying our needs, some of the approaches that Rilwan and I were sort of talking about and wanting to share with you is, really taking the data. The evaluation of your data is so important in this process as you take it from a report to, your next step. And so really looking at what are the themes that were shared during your focus groups, during your, the different ways, maybe it's through your community surveys, maybe it's through your collaborative online groups. What were the themes that were, that kept coming back and really thinking about, oh, I'm sorry about that, and really thinking about how to best prioritize those items compared to what it is that you do at your agency or with your community partners. Prioritizing that list from the community needs survey. So we have, you're looking at different data sets and trying to find those commonalities and really to be able to, in some ways, read between the lines to be able to see where the correlations are between those community discussions and what's actually on paper, and then developing a process to reduce those priorities down to a manageable list. Because, like I said, I believe when we went through both our themes and the needs that were identified from our community survey, I believe that it narrowed down to 35 needs. And all of them very important. And having said that, how do we as community action agencies identify which are the top needs? So as I said, the evaluation piece is so important.
There was a question in the chat as well that asked about how the distribution of the surveys were done. For the individual survey that we did for the 7,000, they were actually paper copies. Our community statewide association is doing them through paper, and we started using QR codes as we got a little more advanced with the technology to be able to do those. And then we're going to follow them up with a bunch of focus groups and in person as well. But one of the things I would say to this is, again, I believe I added a slide. When we did our assessment, we had about 7 priority areas that we were hoping to get out. And that was a subset of a larger group of things that are there. But I think it's also important is, again, that we limit those, whether it's 5, whether it's 7, we can't do everything, even though we want to. So we've got to be really intentional so that we don't have mission drift. A quick example of that very briefly is we had a large funder that wanted us to be able to receive some funding to do work for communities of color. So being a African-American BIPOC leader of color in the middle of the pandemic, we realized very quickly if we had these small hodgepodge of money that really didn't allow us to do the work, we would be spinning our wheels trying to be able to do that. So one of the great things is understanding mission and alignment was to be able to say to them, we're in the middle of the pandemic, we've got work to do with everyone. Our common factor is poverty, anti-poverty work. So if you allow us to do that work, we're going to get it to the hardest hit, to the most in need, but we don't have time to do special projects in the middle of the pandemic just for one group. And that's not an easy ask, especially when you are in the place of needing funding and wanting to support marginalized communities. But because we had trust-based philanthropy, it allowed us to honor that request and allow us to do it in a way that was holistic, and that really allowed us to keep mission focused and serve many more people than doing a specialized project with limited resources. So at some point, you've got to make that tough decision to decide how you're going to prioritize and be okay to stand on that.
Absolutely. So as you're thinking about the prioritization and the areas that you're going to be focusing on for guiding your work, it's important to really be thinking about what is the level that we're looking to impact. And so is it the family level? Is it the agency level and the community level? And I know that that depending upon your organization, so for example, our statewide association, their prioritization and their level for planning is more of at the community level. Whereas for my specific agency, we are developing goals and strategies that will address all levels of planning. So definitely important for us to be, as we're really thinking about what it is that we're going to impact and what it is that we're going to change, at what level, because your goals and your strategies will need to shift based upon the impact or the level of impact that you're going to be making.
As we were planning, we just had those epiphany moments and those aha moments as we're going through. So if you've been around in community action in our world for a while, whether it's Roma, Next Gen, all of our implementers there, I think we all realized community is the hard work. And as we were kind of going through this list, I think many of us, most of us, I would dare to say, do really well at collecting and analyzing data at the family and agency level. That's our backbone, our bread and butter. But community for many of us still is a hard place to be. And so again, I think that's a place where as a network, we want to share our best practices, our lessons learned. I was glad to see your earlier presentation talking about whole family. But as a group, it's hard, but it's the work that needs to be done. And so this is our learning community and our ability to kind of share those resources. So if you're out there and you're still struggling with it, you're not alone. We wanted to raise that and elevate that. But again, there is work to be done, and there are best practices that hopefully we get a chance to talk more in detail through our pick and other places as we move forward. But just had to recognize that and raise that for many of you. But collectively, we're getting there, and we will get there.
Absolutely. So once you've collected all of your data, sort of identified what are the top needs that we're going to be focusing on for the next few years, what do you do with it? What do you do with it then? What are your next steps, and how do you get the community involved? And so making sure that you're sharing the information that you've collected and including the community in your process is the key. making sure that this information is not only going to be utilized for your own internal uses, but really this is a community assessment. And so sharing that widely so that others can benefit from the information that we've utilized. And it may be an opportunity for us, like Rilwan was saying, we were both, discussing how community level impact can sometimes be so challenging. And so there perhaps could be opportunity for additional or new partnerships as a result of some of the information that we share with these reports. And so some of the ideas that we've found to be successful is, of course, as we're required to share the report with our board of directors and really have them involved in the process from the get-go. I know that our board of directors were very involved in our process. They helped us with, sending out information and trying to recruit consumers for our focus groups and, sharing the information about the community survey on their Facebook pages and their Twitter accounts and, all of those things to help us to gather as much information as possible. And so really looking toward your directors and your governance entities to really support you, not only in the development of your report, but in the dissemination of it as well. We also, having it available on your web, having your report and other accompanying documents such as your strategic plan available on your website so that people are able to look at that and be able to see what it is that you're working on and why it's important to you. I'll turn it over to you, Rilwan.
Yeah, question again, spanning is, we do in Rhode Island and on the local level, we do different reports for different audiences. So again, this is just a small subset of those stakeholder groups that you want to be able to disseminate the information to. So our mass media appeals are very different than our consumer appeals that we put out, which are different than the policy and decision makers that you see here. And that's both at the local and state level. One of the things that we had in common is we often do our dissemination of our reports at our state houses or at our local city halls to make sure that policymakers, decision makers are keenly aware of what's happening, because again, these are their constituents. We often handle all of those consumer issues that they don't have to face on the municipal level. So we want to make sure that it's tailored to them for local funding opportunities, but also policy and decision making that impacts the work that we do every day. The other part that's, I think, really critical is the feedback loop for those that have been part of our focus groups or the surveys. We often neglect to close the loop with them. So we've used them and talked with them and they participated, whether with incentive or not. But at the end of the day, have we told them what the findings are? What were the lessons learned that we found? And what is the plan to address the concerns that they have at the end of the day so that they're more willing to be part of that feedback loop and that they know that we're actively engaging with them. We haven't just used them for research purposes, but we're actually making change based on their input. The thing that's not there, and as we were thinking about it, is also to funders and foundations. We were really fortunate that we did that off-cycle local assessment. And we had a lot of our funders come to us and approach us for that data and be able to share for their own assessment and their next steps. So we do this work so that we can inform, change, and elevate the work. But for us, it was also an opportunity to be funded for the research and work that we did and add another subset or secondary data set for others. And it had value, monetary value for other groups that were not able to collect what we were able to do in the middle of the pandemic, as an example.
Absolutely. So lessons learned. So one of the lessons learned for our organization, and I think as being part of the first time for us to be part of a statewide needs assessment, is really the involvement of your leadership team and your governing body. There were engagement was, each agency had different levels of engagement of their leadership and governing body. And one of my takeaways in being, I was the liaison between our state group and the consulting firm that assisted us with the development of our report. And for those agencies that did have that leadership and governance support, the data was more rich. The involvement was definitely more widespread across the organization as far as the participation of focus group members, of stakeholders, and then of course in the process of prioritizing the needs. And so I can't stress enough, that was a takeaway for me as an observer, as sort of an observer in that process, is really the importance of having that buy-in from your leadership and your governing body around this process and the needs and the data assessment that goes along with it.
Could I also add to that buy-in and the ability to delegate? So as a president and CEO of one of our local agencies, I was one of two that actually liaisoned like you did to our state plan, to our state group on that. And we made it very clear, either the EDs were going to be a part of it and give their blessing and be actively and fully a part of it, or have someone a part of the group that they could delegate to make real decisions. It helps it so much to be able to proceed and move without having to go back or wait between meetings, have people that are empowered to be able to do that. So again, that involvement is really critical to move it along, and having a really strong leader relationship with your evaluator or outside team if you're going to use one. So I just concur and can't lift that up enough to have the buy-in and delegation.
Absolutely. Making sure that you allow the time for planning and coordination. This is not a finish it in a week kind of a project. I will say that our experience in Maine for our statewide assessment, it was just shy of a year for the entire process to happen from the RF, because we did decide to go with a consulting firm. So from the RFP process until reports were disseminated to the agencies and reports were given to the board of directors, it was just shy of a year process. And the time commitment from the agencies that came to the meetings to really look at, what are the questions that we're asking? Why are we asking these questions? What's the relevance to the work that we do, and why are, because we don't want to ask a question just for the sake of asking the question. And so a lot of really great conversation. And so I want to stress the importance of taking the time to truly plan so that your results are meaningful to the work that you're doing.
Absolutely. The next one is, again, looking at incentivizing the work for clients and possibly staff. We always feel that it's a better carrot than stick approach to the work that we do. So for the folks that we're serving, particularly during this time of being in a global pandemic, to be able to give an incentive, whether it's gift cards, whether it's meals at our focus groups, are just really, really key to value and honor the time of those that are contributing to the work in the process that we're going through. So we made a really intentional process of making sure we had a budget built into our assessments that we could be able to do. Gift cards work really well in Rhode Island. So across the agency, I think we all committed to do several $100 gift cards, and we pulled and raffled those as opposed to a bunch of individuals. That process has been done before, but we had really good utilization of that approach. And so there were just 3 dozen gift cards out there that people could kind of choose from, pick, and each agency had a designated amount. We talked about also staff. I think one thing that's often overlooked is staff doesn't always know why they're doing it. Not all of us have individual data folks that are part of the work or evaluators on staff. So often we draw through the ranks and someone gets the short stick and now they're part of the needs assessment team. But we really want to make sure that they understand why they're part of the group, and they understand the value added that they're giving by maybe taking on another duty that's not normally assigned except for every 3 years or every year for this process. So we made sure that we had fun with it across our agencies. We made it fun and a fun competition. So we had weekly kind of updates on how many and each agency had gotten survey amounts in, and staff just really enjoyed it. But more importantly, they knew that their contribution to the work was going to make us better agencies and better ability to assess the needs of our community and deliver better programs and supports. So again, if you can make it fun, it's always better to have it as a reward or something that's incentivized as opposed to just an add-on, if you have the ability to do it.
Sure. And I will say, we in Maine also did the incentives, but I think one of our challenges that we didn't think about as we were trying to distribute the winners of the gift cards was that a lot of individuals are skeptical right now of scams. And so we actually had a difficult time in dissemination of the gift cards to the winners, because some of them thought it was a scam. And the other thing was some of the email addresses we weren't able to get a response from them. And so after speaking with Rilwan, and so I wanted to share this, was the lesson learned for me was having a local representative to be that person that lets someone know that they have won the incentive, because that way, it's for example, it's ACAP calling, it's the ACAP number that comes up on the ID, or it's the ACAP email address that's reaching out to me. And so that's something that's familiar to our community members. And so I wonder if perhaps we had attempted a different approach to dissemination, if we may have had a different result in we said we didn't realize it would be this hard to give money away. But definitely incentives certainly have helped us, and we'll be thinking about that as we go forward in how to best get the winners their prizes. So
another lesson for us, and it was about timing, as we were social distancing and doing all the things that we were forced to do over this period, was we started again utilizing QR codes for the first time. So we had never really done that as part of the outreach. We thought it would be easier to kind of go through our food bank lines and pantry lines and just have people scan it to be able to pull it up on their own phones. Great idea and thought, but the same week that we launched and got them all ready and all the work that went into them was when, if you remember, the scams were going out about the QR code. So it linked back to restaurants, you were scanning it and people were getting the hijacked by the QR code. So we had spent all this investment in time and energy to do them, and the same week that we were ready to go live with them, the big scandal kind of broke nationally about those. So you can't account for timing, but it was just, again, lesson learned. You just never know. But fortunately for us, as Jamie said, we're a trusted group, so folks knew because it was in our pantry line or they were given out by our staff that they could trust those and believe with them after being questioned about them. So we learn and we keep moving and adapting.
Absolutely. And then, of course, I think both Rilwan and I have mentioned this in earlier parts of our presentation, but really making sure that you have the support and the both resource support and the fiscal support to do an adequate evaluation. I think we can't stress enough the importance of being able to really drill down and really understand what that data is telling you. And if you don't have appropriate resources to do that, it certainly will impact the quality of the report that you have. And then of course, the downline to that is, as you're planning programming, are you truly, setting programming up to really truly meet the needs that were identified in your report?
And we're all different across the region, but I know at least in Rhode Island, we feel really supported by our CSBG administrator. So they heavily invest in doing our statewide assessment as well. So again, if you're not tapping into that or trying to figure out through our pick or other places to do it, we build it in individually through a lot of our grants. We believe in assessment. So we find any opportunity we can to tag those resources where we can. But on the state level, if you're doing the kind of work that most of us are doing, hopefully your CSBG administrator is part of that, and they're benefiting from the larger data as they're kicking it back up to the feds as well. But another great resource if you are not utilizing that to build into your design. And I think we actually left some time in our presentation to open it up. I know some folks are doing breakout groups and other things, but we wanted to leave a little bit of time live if folks wanted to ask questions, if that's okay, in the chat, and we can possibly answer them if you have any. And we also understand we're the last thing between you and lunch. There's no offense taken if folks are ready to go as well. We thank you for that, Jan. And we hope we've demystified this process that can be a little bit challenging for folks.
And Lexi does have a copy of our slide deck, which also includes our email addresses. So if you have a question that you think of later today, or you know, a week or so, or maybe even when you're planning your next assessment, please feel free to reach out to either of us. We're happy to answer any questions that you may have.
And with that, if there's no questions, Lexi, we'll turn it back over to you. We thank everyone for your time today. Oh.
Actually, Rilwan, a question.
Photo voice. Is this a phenomenal ability to utilize action researchers? They are intended to be of the community. So they're trained on a bunch of research methodology on how to actually do motivational interviewing, how to be able to design research questions. So you design a research, they actually designed the research question with some input from us. We really want to talk about poverty in the work of community action and how that was impacted by COVID. So they really went in and designed individual approaches to slice and dice that research question. So we had individuals that were working with housing insecurity, that were going and working in that sector and seeing how they were impacted. Others were looking at blended families, or those that have members of the family that are don't have legal status but are still eligible for some of our services or our programming, those that were not eligible for federal benefits. So they really make that question and take it on themselves to go in communities that they're familiar with, do research with key informants in the larger population. The medium is done through visual arts. So they do storyboards, visual boards, or videos. And it's another tool that we utilize once the projects are done to be able to share with policymakers, decision makers. So in addition to doing our report outs, we literally were able to share with our decision makers and policy folks actual storyboards, actual lessons learned from the communities and from those members that went into their communities to do it. So just another phenomenal vehicle. If you Google and look at it, just a ton of literature out there on the process and how it can be utilized. So that's a very quick and dirty look at photo voice. It's intense. It's a 4 weeks of training before we unleash them onto their community with a bunch of skill sets as researchers. But it was also for us a jobs program during the middle of COVID that allowed us to actually pay them. This is not free. It's not volunteer. It's part of, again, employing folks through COVID to do this really important work. We value them as action researchers. I hope I got that answered quickly.
I'm sorry, I kind of have a few more questions if you don't mind me just asking them instead of putting them in the chat. It looks like you did it with storyboards, videos, and drawings. What about when you shared that, what about confidentiality? Did you get permission ahead of time to share all that stuff? Okay, so.
Absolutely, that's a big part of the work and why we do those weeks of training before they're allowed to go. So again, we don't want to re-victimize people. It's not a blaming or shaming kind of things. The power of the story, and again, if you have questions, please feel free to email and I can share some of the examples. So looking at things like housing insecurity with people sleeping out on mats and those kind of things. So there's really a process of making sure that we protect identity, that it's fully informed, and that they're sharing their story and likeness. So that's a very major part of the work that goes into getting them trained and ready to do this kind of work. Thank you for that question.
All right, I don't see any other questions. So thank you so much, Rilwan and Jamie. That was so informative, and we really appreciated having you to talk more about community needs assessments today at our regional convening. As Rilwan kept mentioning, it is lunchtime, everybody. So we will be back at 1 o'clock for our next round of highlighted initiative presentations. We hope you all can join us back. It will be the same exact meeting link. So feel free to just click that again. But thank you all for joining us for the morning, and we hope you'll be back for the afternoon, and we'll see you at 1.